Hello, I'm Dr. Rachel Hall of Evolved Dental Healing, holistic dental practice in Brisbane. And today I'm going to talk about mercury-free dentistry and mercury-safe dentistry and what that means for you. So as an holistic dentist, I care about your health and well-being, and I understand that what we do in your mouth impacts on the whole wellness of your body and vice versa. So it's really important that we understand the safety of the materials that we're using in your fillings, and also what's happening when we're replacing or drilling out those old silver metal fillings. So when it comes to amalgam-free dentistry, is that enough? There are many dental practices now who are advertising and stating that they no longer use amalgam or that they're amalgam-free. And that's great that more and more dentists are choosing to no longer use amalgam. But my question is, are they really aware of all the issues that are associated with mercury that is in these fillings? It's obvious that in regards to mercury amalgam fillings, that dentistry is heading to a new direction, and that there will be a shift as more and more dentists are rethinking whether they should use this material and whether it's actually safe. In 2008, it was estimated that over 50% of dentists were using amalgam, so that's 50% who weren't. So the majority, however, stopped doing so. They didn't stop using amalgam because they didn't think it was unsafe or it wasn't good, but they were more concerned about the push for our patients to have fillings that are more natural. You know, you want tooth colored. However, it does provide an insight into the future of amalgam fillings while their usage is dropping out of favour. And I think eventually dentistry will become mercury-free. But is being mercury-free enough? And for me, the answer is no. Not placing amalgam is fantastic, it's really beneficial, but I don't believe it's enough to just be an amalgam-free practice. We know that significant amount of mercury vapour are released when an old amalgam filling is drilled and replaced, but very large amounts are removed, and when it's done unsafely, you're going to breathe that in. So not placing amalgams is not enough. Referring to as a dental practice as amalgam or mercury-free, fantastic, a step in the right direction. And it is important, but it's only the first step. And why is that? Because mercury-free doesn't make a dental practice mercury safe. The amount of mercury vapour released when an old amalgam filling is unsafely removed far exceeds the minimal levels set by every government regulatory agency. It becomes imperative for the dentist to take the necessary steps to protect the patient, you, themselves, their staff, and the environment from the mercury vapour and the mercury deposits that are created during the removal procedure. And the only way to effectively minimise exposure to mercury vapour at the dental office is to protect the dentist, the staff and the patients and the environment, is to do this with special dental protocols that is a mercury-free practice and a mercury-safe practice. So what does that mean? Well, for the dentist, studies have shown that dentists and dental assistants, dental staff, have elevated levels of mercury. It's shown that dentists suffer from a higher incidence of things like tremors, slower reaction time, high levels of mercury in the kidneys, which can cause kidney damage, pituitary gland problems, memory disturbance, higher heart rates, nervous disorders, emotional changes, insomnia, headaches, high divorce rate, higher incidence of poor mental health and suicide than the general population. Female dentists and female dental assistants have higher incidence of aborted, miscarried pregnancies and a higher rate of birth defects with their offspring than the general population. The fact is that every day dentists are putting themselves and their staff at risk if their practice is not mercury safe. That is very concerning. So what does that mean for you as a patient? Exposure to mercury can directly and indirectly contribute or make worse nearly every symptom and health issue that dental patients deal with. So mercury from amalgam fillings is believed to be a major contributor to things like autism and other learning developmental disorders. Patients deserve to be protected from unnecessary exposure to mercury at the dental office. Environmental impact. 1/2 gram of mercury, the amount of mercury in an average size amalgam filling, can poison a 10-acre lake, making it deemed that you can't eat the fish from there. Are dentists doing their part to protect the environment? This is a very key and important topic. So, is Evolve Dental Healing mercury safe? Well, yes, we are. At Evolve Dental, we are both mercury free, we don't use amalgam, we have never done, and we are mercury safe. We take every precaution we can to ensure we minimise the exposure of mercury to you, the patient, us, the team, and the environment. All amalgam fillings are removed under rubber dam with the use of an air filtration to protect members of the dental team and the patients during the process. Amalgam is recollected and filtered out from our suction system, so that prevents it entering the water supply and contaminating our drinking water and the environment. When we collect amalgam bits, we store them under special chemicals to prevent any mercury outgassing, and then this is taken away by a hazardous waste company. So if you have silver fillings in your teeth, they contain mercury in 90% of cases. So if you're looking to improve your dental health and your overall wellness, not only choose a dentist who is mercury free, but look for one who is mercury safe. I hope you've enjoyed this. I'm Dr. Rachel from Evolve Dental Healing. Please like, comment and subscribe. See you next time.